We're proud to offer some of the most competitive medical benefits in southeastern Michigan. This comprehensive medical coverage is an important part of supporting your healthy lifestyle. It offers preventive care, helps you when you are ill, and protects you from catastrophic financial effects of serious illness or injury. Your benefit package offers a number of medical plan options that cover the varying health needs of you and your family. These include Beaumont Employee Health Plan Choice Account, BEHP Classic, and the HAP HMO. Or you can waive medical coverage altogether. Each medical plan offers quality coverage and has its own unique features. We will be taking a closer look at each of the plans in a moment, but first let's review some of the features that are common to both of the BHP plans. As we mentioned in the introductory segment of this DVD, you can choose among 4 levels of medical coverage, regardless of which plan you elect. Just for yourself, you and your children, you and your spouse, or you and your entire family. In addition, both the Choice Account and the Classic Plan cover the same healthcare expenses, just at different levels. They also share the same provider networks: Beaumont Network, Expanded Network, and Non-Network. Under both plans, you can see any provider you wish, but the plan covers a greater portion of the cost if you visit providers in the Beaumont Network. To receive a directory of Beaumont Network providers, please contact the BEHP Member Services at 800-462-0189. You can also view an updated version online through the Inside Beaumont employee website. Just click on My Beaumont Advantage and then select the My Optimal Health page, and you should see a link to the BEHP provider directory. If you choose to see a provider who is not affiliated with either the Beaumont or Expanded Networks, your eligible expenses will be reimbursed at the plan's reasonable and customary rate. These are the rates typically charged by providers in the same region for the same procedure or service. Out-of-network charges that go beyond these R&C rates will be your responsibility. Both plans may require pre-authorization for certain services. This helps guard you against being charged for expenses that are not actually covered by the plan. The providers within the Beaumont or Expanded Networks are aware of which services require authorization, but if you see a provider outside these 2 networks, you will be responsible for obtaining this authorization. Now let's take a closer look at each of the medical plan options.
The Choice Account is considered a consumer-driven health care plan. As the name implies, this type of plan puts you in the driver's seat, allowing you to have more control over how your health care dollars are spent. Now, let's take a closer look at how the Choice Plan works. Anything new can be a bit intimidating at first, but understanding the Choice Account is as easy as 1, 2, 3. There are 3 main parts to the Choice Account coverage: a personal health fund, a health bridge, and traditional PPO coverage. So let's walk through each part of the coverage now. It starts with the Personal Health Fund, which is funded by Beaumont, but is managed by you. Each January, Beaumont credits your Personal Health Fund with an annual contribution that you can use immediately. As you can see in this table, the amount Beaumont contributes is based on which coverage level you elect. The Personal Health Fund is your first source of payment for any health care expenses you incur. The fund pays the full cost of the service. You don't have to meet a deductible or pay a co-payment. If you have money left in the fund at the end of the year, it stays in your account so you can use it toward future expenses in the next year. So, the lower your health care expenses, the more you can build up your health fund. It is important to realize that you do not have to use your personal health fund to pay for any preventive care. These types of services are fully covered by the plan. So that means you can have your annual physicals, get your kids immunized, and have various health screenings without tapping into your personal health fund or paying out of your own pocket. The Choice Account pays for preventive care to encourage its members to get the care they need in order to prevent illness and injuries. Preventive care services include well baby care, routine immunizations, pediatric physicals, adult preventive physicals and testing, annual OB/GYN visits, pap and breast exams, PSA blood tests, and flexible colonoscopies. Preventive care benefits are paid based on age and gender guidelines, so check with your provider to make sure what you believe to be a preventive care visit is in fact covered as such. Remind your provider to code the visit as a preventive care visit to make sure it gets paid by the plan. There may be times when your health care expenses go beyond what is available in your personal health fund. In this case, an annual plan deductible must be met before the traditional health care coverage begins. As you can see in the diagram, you and Beaumont share in covering the cost of the annual deductible. Beaumont contributes by providing the personal health fund. The remaining portion of the plan deductible is your responsibility and is called your health bridge. It is important to understand that the personal health fund and health bridge work together to satisfy the annual plan deductible. Here's how. The health bridge amount is equal to the full annual plan deductible minus the personal health fund. This means that as your personal health fund grows from rollovers each year, your health bridge amount decreases. It may be interesting to know that 2/3 of Choice Account members still have money left in their personal health fund at the end of the year. This means most members never even get to the point where they need to pay toward the health bridge or use the traditional component of the coverage. Also, here's a tip to remember. Any expenses you pay as part of your health bridge can be reimbursed through Beaumont's health care reimbursement account if you participate. Once you satisfy the health bridge requirement, the plan starts paying benefits through its traditional health coverage. As we mentioned earlier, the Choice Account's traditional coverage is a PPO that covers the same eligible services and uses the same provider networks as BEHP Classic. You share in the cost by paying coinsurance. As you see in the chart, your coinsurance amount depends on which network you use. Your portion of the cost is less if you use providers in the Beaumont network. As added protection, the Choice Account has an out-of-pocket maximum that protects you from unexpected health care costs by limiting what you will have to pay out of pocket in a given year. For example, referring to the chart, if you had employee-only coverage and had a significant health care expense, you would have the comfort of knowing that you would pay no more than $1,500 out of your own pocket for the year. This includes money you spend on the health bridge and coinsurance. The plan would cover the rest. Now that we have reviewed how the Choice Account medical coverage works, let's look at prescription drug coverage offered under the Choice Account.
Unlike the Classic plan, which has a separate deductible and coinsurance for prescription drugs, the Choice Account covers prescriptions like any other medical expense. You can purchase prescriptions at a Beaumont pharmacy or one of the Caremark network pharmacies. Your portion of the cost is the same regardless of which one you go to. However, the base cost of the drug may be less at one of the Beaumont pharmacies, which means your portion of the cost is less too. Here's how your prescription coverage works. As with medical expense, your first source of payment for prescriptions is through your personal health fund. Remember that it is the full cost of the prescription that is paid by the personal health fund, not just a copayment amount. As a member, you will receive a prescription drug debit card that allows your prescriptions to be paid directly from your personal health fund. It is important to understand that the pharmacist will not know the current balance of your personal health fund, so it is important that you check your balance before using the card. To find out how to do this, refer to your enrollment guide. If you don't have enough in your fund, you may need to pay a portion of the cost at the time you pick up your prescription. If you need prescriptions after you have depleted your personal health fund, you will pay the full cost of the prescription out of pocket as part of your health bridge requirement. Once you meet the health bridge that we discussed earlier, the plan will cover your prescription drugs at 90%, as long as you use a Beaumont or Caremark network pharmacy. Both your combined medical and prescription costs apply to your out-of-pocket maximum, so once that maximum is met, your prescriptions would be paid at 100% by the plan for the remainder of the year. A few more important things to know about prescription coverage. Your prescription drug coverage is based on using generic drugs rather than name brand drugs. If you chose a name brand drug when a generic alternative is available, you will pay the cost difference. Although it may be tempting to pick up some milk or bread when picking up prescriptions, your debit card cannot be used for any expenses that are not covered under the health plan. You'll need to pay for those items separately. I realize I've just given you a lot of information to digest. Let's walk through an example to see the choice account in action.
Meet Loretta and Joseph and their son Alex. They chose the choice account because of the lower payroll deductions, the fact that their preventive care services are paid in full by the plan, that the co-insurance for prescriptions is only 10%, and the possibility that they can roll over any leftover money. Now let's look at how the choice account works for the Stevens family. First, we'll take a look at their overall coverage, which assumes they have family coverage and receive their services from physicians in the Beaumont network. As you see, their preventive services are covered at 100%. The annual plan deductible for family coverage is $1,000. $500 of that is offset by Beaumont through the Personal Health Fund. If they exhaust their fund, the Stevens family must meet the Health Bridge amount of $500 before the traditional coverage begins. Once the traditional coverage begins, the plan pays 90% of eligible expenses and the Stevens pay the remaining 10%. Keep in mind, these amounts are the negotiated fee schedule rate, not the retail rate. In the first year, they had $600 worth of expenses considered preventive care. Their non-preventive care equaled $6,920, giving them total annual expenses of $7,520. Let's see how the coverage worked for these expenses. The full $600 of preventive care services were paid directly from the plan. The Stevens didn't have to pay any of those expenses. The first $500 non-preventive expenses were paid with Beaumont money from the Personal Health Fund. The next $500 were paid out of pocket by the Stevens. At that point, their traditional coverage kicked in. After the Stevens paid the 10% co-insurance, which equaled $592, the plan paid the remaining $5,328. All in all, at the end of the year, the Stevens paid $1,092. Let's take this example a step further and look at how the total costs compare between the choice account and classic plans. First, let's look at the payroll deductions. Think of this as your fixed cost or the amount you pay each pay period, regardless of whether you use health care services. Then, let's look at cost sharing for covered services. Think of these as variable costs that change based on your use of health care services. These amounts include co-pays in the classic plan and health bridge and co-insurance in the choice account. Now, let's look at the total under each plan. It turns out that moving to the choice account would save the Stevens almost $400 that year.
Now let's turn our attention to the classic plan. The classic plan is a PPO plan that provides you and your family with comprehensive health coverage while giving you the freedom to visit any licensed provider of your choice. With the classic plan, you absorb more of your share of the cost up front through the premiums, the part you pay through payroll deductions, and less at the time of service through co-payments or co-insurance. Let's take a look at how this plan works. As we mentioned earlier, the classic plan has the same provider networks and covered services as the choice account. If you seek care from providers within the Beaumont network, you do not need to meet any annual deductible. The plan immediately begins paying benefits. If, however, you visit providers in the expanded network or a non-network provider, each member and/or family will need to meet an annual deductible before the plan begins paying benefits. Looking at the following chart, you can see your benefit varies depending upon which network you use. Typically, if you use the Beaumont network, you do not have any deductibles and the plan will pay the full cost of eligible services. If, however, you visit an expanded network provider or a non-network provider, you will pay a portion of the cost as you see here. Under the classic plan, there is a co-insurance annual maximum that provides protection in case you or your dependents have a substantial amount of medical expenses in 1 year. It defines the most you would pay in co-insurance in a given year. Once you meet this maximum, the plan pays the full cost of covered services. The amount of the annual maximum depends on what coverage level you elect and which network you use. The plan tracks where you stand against the annual maximum and lists it on your explanation of benefits. The classic plan includes coverage for prescription drugs. You do not receive a separate prescription drug card, you just use your medical ID card. Your prescription drug coverage under the Classic plan requires you to meet a deductible separate from any medical deductibles. Under Classic, there typically is a $50 per person or $100 per family deductible for prescriptions. However, that deductible is waived if the prescription is purchased from one of the 2 Beaumont pharmacies we just mentioned or from one of these pharmacies. Lastly, an alternative way to fill long-term and maintenance drugs is to use Caremark's mail order program. You can refer to your enrollment guide for details.
A third medical plan option is the HAP HMO. This plan has higher per pay period costs for coverage and low costs at the time services are rendered. Typically, you will pay a co-payment for services. With an HMO, you must elect a primary care physician to manage all of your care. You must have a referral form from your PCP for any specialist care. If you see a specialist without this referral, the plan will not pay benefits and you will be responsible for the full cost. Under the HMO, you also must use participating providers or no benefits are paid by the plan. There are no non-network benefits as they are under the Choice or Classic plans. So, if you would like to join the HMO, please enroll online and also contact the Benefits Service Center to register your PCP election. If you are enrolling in either the Choice account or Classic plan option, you must complete a Coordination of Benefits form. What we mean by coordination of benefits is that if you or a dependent is covered by more than one medical plan, typically as a beneficiary on your spouse's plan, the plans need to coordinate their benefits to avoid for paying services twice. The BEHP plan is the primary plan for Beaumont employees, and your spouse's plan would be the secondary plan. By coordinating your benefits, you'll receive the full benefits to which you are entitled under the BEHP plans. But it does not mean you can combine your 2 sources of insurance to pay 100% of the cost of services. This approach means all employees receive the same level of benefits regardless of whether they have access to one source of insurance or multiple sources. It is also important to note that the BEHP plans are considered a secondary payer when coordinating with Michigan No-Fault Automobile Insurance. You can complete the Coordination of Benefits form online while enrolling for benefits. Just look for the COB button on the screen. Or you can fill out the hard copy version of the form that is included in your enrollment packet. Please refer to your enrollment guide or contact a Benefits Service Center representative for more details on how your benefits are coordinated. That concludes the medical and prescription drug overview. We hope you found this information helpful. For more details, please refer to your enrollment guide or the medical summary plan descriptions. You can obtain a hard copy from the Benefits Service Center or view an online version by going through the Inside Beaumont employee website.
To talk with someone about the medical plan options, contact the Benefits Service Center at 248-551-0712. Thank you.